Just in case anybody's wondering how are working people feeling, I don't know. Do you need me to tell you to put your mask over your face? I want more for you than that. I do believe that people are greater than that.
Who keeps us safe? We keep us safe. This is one of the cries heard and chanted at Black Lives Matter protests. For the first 2 or 3 protests that I went to, I gave very little thought to what we chanted as we marched down the streets of New York. I was operating from a place of renewed anger and sadness at not only the casual way George Floyd was murdered, but at the way people who I'd known were finding ways to justify or quiet the outrage over George Floyd's death. Shouting anything was honestly somewhat therapeutic. But then I thought about what it takes to truly keep each other safe. We were and currently are in the middle of a pandemic, where people are getting evicted from their homes and apartments. Domestic violence is on the rise due to increased isolation, and we are surrounded by people who feel that it's a matter of personal liberty to not follow age-old and common sense practices in order not to infect those around them with a potentially deadly virus. In this episode, you'll hear from Vital Information's very own Emily Addison, a retail associate and co-founder of Vital Information, Dina, a social worker and a part of the bargaining committee for her union, Tamra Green, a patient registrar at New York Presbyterian Hospital, and Kaslyn Bos, a bartender and restaurant worker. A common theme throughout all of these essential worker experiences included rising distrust for employers after decisions prioritizing cash flow over employee safety were made, the challenge of keeping themselves healthy physically and emotionally despite the dramatic increase of job responsibilities and decrease of employees to help carry the workload. And most importantly, how few customers and patients seem to care or keep in mind the humanity of those providing services. I want to live in a world where we can care for each other and keep each other safe in whatever way we can. After hearing these stories and seeing what's going on around me, I wonder, can we? Another quick note, thank you so much for tuning in and giving our podcast a listen. You might hear some sounds that will definitely make you realize that we are recording this in Brooklyn, and for that I apologize. Thank you for your patience. You're about to hear Emily Addison describe a little bit about what was going on at the start of the pandemic for her.
I think that there are those of us who have to go to work. And I think my decision to go back to work was based on, I don't know how long this unemployment's going to last. I've never had to be unemployed. And I honestly, the culture, I only know working all the time. I live in New York. Like, I got 2 jobs right now. Technically, I got a bunch of jobs because the job I got didn't pay me enough. My mom said to me at one point in time when I was home, it's hard to say, is everything we do unsafe? And it's strange to think about, like, when you're in a pandemic and you're dealing with a virus that is, like, literally comes through the air and affects your ability to breathe. I don't know. Is that, like... And we didn't know. I think at this point in time we didn't know, and we know some now. It would be hard to say, it would be too general to say our government should have been wholly prepared to financially provide for the masses. But you kind of have to wonder, hospitals don't just get overwhelmed. People don't just get overworked. Domestic violence doesn't just metastasize out of nowhere and then spike to the highest levels. We've seen people experience domestic violence possibly ever. Those things don't just happen. Like, you and I both know that Black people definitely didn't magically just start having bad healthcare in 2020 and experience violence in the way that we have. And I think what COVID did for myself and for many other working people is just crack open the holes in how we treat working folks. And I think that is probably, like, what was the feeling of, like, I have to do my job, is the very obvious, I'm just a working person. I'm not a person, I'm a worker.
You kind of answered why you went back to work a little bit, but do you want to add a little more to it?
Yeah, I think, I would like to share this because I hope that if there are other people who feel this way, that they understand that they are not alone, and that, like, I didn't know what to do. I did not know what to do. This is nothing like this has ever happened to any of us before. And I did not feel I had choices. I felt like I felt the stigma of being unemployed. I felt the stigma and all of the things that I didn't really understand that I had learned because of classism about how we look at people. And I think that also really did shift my narrative going back to work. People should be able to live when they can't work. And I think people say that that's very millennial, but no, you should be able to have a place to sleep at night and to be able to wake up and eat, even if you cannot be employed. I don't think that is a lot to ask. I think that people should not have to suffer and be houseless or have shame and fear, and go back to jobs that might not keep them safe because of how we treat people with access to income. Because it's interesting, we don't treat trust fund kids that way. We have no problem with people who are upper income who don't work. There's clearly a disparity in the way in which classism is apparent. Obviously, we see classism. I think, fully become cognizant of where I sat in the rungs and the ways in which we treat people who give us things that we deem essential, because we don't treat them like they are essential. We treat goods like they are essential, and we treat the economy and the markets and businesses at large, quote unquote, like they are essential, but we don't treat human beings that way. And that became very apparent to me, because it was very easy for people to prioritize their comfort in my place of work and familiarity over safety. So obviously, absent-mindedly, why would you change this thing that I know to be comfortable for me? How could you do that? Just recently, my job had to change the way that I'm currently employed in a different retail space now than I was at the beginning of the pandemic, and they just recently limited indoor shopping further, so we were allowing people to come in small amounts, and now we're not at all. And the number of people who are surprised, I'm floored. I mean, truly cannot fathom. The people who are mad at us, I'm you get in line, kids. Privilege sucks, I'm sure. But the people who are why did you do this? And I'm where do you live? Do you have eyes? You seem like one of those overeducated NPR types, so I'm surprised that it hasn't occurred to you, because literacy is accessible, at least to the people coming into my job. In terms of the socioeconomic and educational demographic of people who are coming into my job, a vast majority of them definitely have access to the news. And they go, what do you mean I can't come in the store?
New strains? What?
We read the same news. I did eventually explain to someone, it is safer for you as an individual, especially if you're working from home, to access these spaces in limited amounts. To go into a restaurant at 25% is safer for you because it's you and 25% fewer, max amount of people, which is 75% less people than are normally there. If you see 100% of people in your workday, because you're there all day, you don't get to leave and enjoy your lunch and go home, you have to work all day, you are just as at risk as you would have been in any other day. You're slightly less at risk, but I don't know, is there a difference between 100 people and 400 people in a pandemic? I see probably now less, but I see probably between 30, as an individual, 30 to 100 people in a day at my job. Is that safe? Sure, only 4 people come in at a time. But 100 people, I had to speak to 100 people. What are the odds that one of those people is sick? I can do math. So I know based off of what the New York Times is telling me about what the number of people per capita in my area is, and I can do a little math and multiply that in terms of how many people have I seen in a day. Just in case anybody's wondering how are working people feeling. I don't know. Do you need me to tell you to put your mask over your face? I want more for you than that. I do believe that people are greater than that. I think that at a bare minimum, more concerned for themselves. You got as far as putting the mask on. Like, you're doing the song and dance, even if you think it's BS. Like, you grabbed your mask and your bros to go to the restaurant for fucking brunch. You know, you needed to get tequila during the snowstorm in the middle of the pandemic from the people who are getting hazard pay. You absolutely had to do it. You can't do the bare minimum and cover your face because you can read a sign. Like, fuck me, right? Fuck me. You just want the line? Complete the steps. It really can't be about people, and that is shocking to me. That is truly shocking to me, because I think, really and truly, I don't know how many people are doing it because they're angry and they don't care. I think a lot of people are absent-mindedly living in a world where they don't need to think about other people.
You really think so? So the majority of people who don't follow the rules, who won't wear a mask and touch things, are those people blatantly trying to break the rules, or they just are like, blah-de-da?
No, I would say, like, I see people who don't care. I see probably, like, 2. And that's crazy also to see the number of people who are mad at us for doing this. It's not that many people, at least, and I live in New York, so I live in the liberal bubble that is, oh my god, people don't want to wear masks? What do you mean? Like, you were just talking about essential oils and vaccines, but okay, people don't want to wear masks. We're shocked. We're truly floored. I live in the age of the internet. People think crazier things than I don't need to wear a face mask. And yeah, and people are just like, it's I can't even really say what it is, because people, I do believe, are genuinely, like, surprised. People came into my job. Like, the numbers spiked after Christmas. We probably should have been limiting people coming in the store, but money. And I definitely know that my current employers feel that way now. It was very clear that my current job did not want to do anything. And honestly, that's because the people who own my job don't work there. They don't come in. And we say things to them, and they're blown away. Really? People are taking their masks off in the store? Thank you, everyone, for listening to my equal parts rant and truth of being a working person during COVID. Next up is Dina.
I am a social worker. I work in sexual and reproductive health, and right now I'm at Planned Parenthood, and I got furloughed from Planned Parenthood and worked at a different reproductive health clinic that I will not name because we'll get to that. But I've been working at Planned Parenthood before the pandemic for almost 3 years, and then when everything hit the fan, I got furloughed, and then had a few months where I wasn't working at all, and then started working at the other place in June. Worked there for 2 months, and then I came back to Planned Parenthood in September. So it's kind of been all over the place a little bit. Before the pandemic, my job there is it's a very like crisis intervention. I usually meet people either for strictly medical stuff, like I do a lot of like options counseling, abortion counseling. I was meeting patients who were starting gender affirming hormone care. So kind of like I can do kind of strictly medical, but then a lot of it also is meeting people when they're in a crisis, whether that's like a, mental health crisis, a housing crisis, anything can walk in anytime. We all know that, like living in New York, you never know what's going to walk through the doors needing assistance or help or support. So a lot of it is just kind of like helping people get their bearings. I don't usually see people more than a couple of times, although there is some flexibility there. And obviously nowadays it seems like some more follow-up is required, but I'm doing resources, getting people set up with like ongoing care if that's what they need. So anyway, before the pandemic, it was already a little bit kind of variable. Like I never knew what I was going to get. And then after the pandemic or during the pandemic, it just seems like people's anxiety and fear is on constant level 100. And there's so much uncertainty right now. There's a huge lack of resources that are available, or at least the resources are very overrun with people needing, especially mental health support, housing, just like other things that were already pretty strapped before are now completely almost unavailable. It's just really hard to get people connected to things. So in a sense, it is hard because I'm sitting with folks in the moment. Like I'm also experiencing it too. And I'm acknowledging to them that like we're all in this moment where I have no idea what's going to happen. I have no idea how to assuage people's fears, because what can I say? I can't like tell them that it's going to be okay in a certain amount of time. So the best thing I can do is just try and like support them in the moment, acknowledge that I get what they're going through in a sense, because I'm also living through it, and I can acknowledge that it's really hard to just, we're going through like a collective trauma right now. We're all in that space. So sitting with them in that moment and trying to link them up as best I can with resources is kind of what I've been doing. But it has been really challenging. It's definitely hard. I think we can all relate to this idea that the shit was kind of hitting the fan in New York, but there weren't a lot of plans in place for how to manage it. So March was nuts in New York City, just in terms of uncertainty, you know, all of these really scary headlines, but not a lot of plan in place to manage the potential for everything getting shut down. So everything was really unknown. In March, I was still working full time in the Bronx Center of Planned Parenthood. So from July of the previous year up until March, I was full time there pretty much. Like I would float to a few other centers, but I was really only in the Bronx. And they basically told us that they were going to have to shut down a few of the centers to manage staffing and to try and consolidate services and kind of, I don't even know what their rationale was. I mean, they're financially having a hard time too. So I think that in combination with lower numbers of patients coming in, and just trying to like tighten the ship almost, they were like, okay, we're going to shut down a few centers and just have the Manhattan Center mainly open for services to try and consolidate people and be able to get some systems in place for safety. Then I was working in the Manhattan Center, and they were triaging people at the door, but again, there really weren't that many systems in place for safety. Like it didn't really feel like we could social distance. The rooms I was counseling in with patients are literally like 4x4. They're tiny, tiny rooms. And so I was next to people talking to them. All we had were surgical masks. And we also had to reuse those because we only were allowed to have one of those every couple of days. So I was having to wash it with hand soap in the bathroom, which like is not safe when you're in a tiny enclosed space with people. So basically all from the middle of March in the first week of April, I was only in Manhattan. And it was pretty wild. I mean, as much as we were trying to kind of keep things as safe as possible, it just wasn't possible with the space and with the lack of PPE. So it didn't feel very safe. And there was a lot of unrest. And at that point, from the union side, having kind of an inside scoop with the bargaining committee, I'd been able to hear a few things that management was saying about potential layoffs and furloughs, but it was all very hush-hush and no one really knew what was going to happen or when it was going to happen. And then all of a sudden, the first week of April, like a bomb, they laid off and furloughed like over 200 people. And that was really hard because they basically just kind of laid this on us as the bargaining committee. And then we decided that we were going to be the ones to talk to our colleagues about it. So I was making calls to people like the day that I knew that I was getting furloughed, I was like calling my colleagues, telling them they were getting laid off and furloughed. So that was really hard. And that was just like so emotional and so challenging and just hard to tell people that I didn't know anything. And I was just like relaying information and trying to, have it so they were hearing it from me and not like a random manager or a random HR person. And they just had people continuously come into work, and they would just like pick people off the floor to lay them off. And so people were walking the halls like crying, and like it was just such a disaster, such a mess. That was really hard. And of course, like at the same time, we're all just trying to stay alive. It feels like so long ago, even though I'm still in it. But yeah, I think it's hard because despite there being a pandemic and people feeling really scared, they were still expected to perform the exact same way as before. People were expected to be productive, see as many patients as possible, keep the cycle times for patients' visits really low, and yeah, just expected to perform exactly as it was before without a global crisis happening, as if it was just not happening at all. In terms of like the union stuff, we've been really fighting for a lot of things. Like we had to fight for better PPE, we had to fight for better like safety practices and social distancing practices. We had like a picket because we're still fighting for our contract, and they were trying to basically it's like there's so many levels to this, but yeah, just trying to fight for our rights as workers, like our health insurance, our just maintaining the status quo of the benefits we had before, all these things that are a huge part of our contract. And we've had to take some pretty extreme measures. I mean, it depends on, like, the context is going to be different in all workplaces. Like, not everyone is going to have the privilege of having a union behind them. So we kind of took to the streets, literally. We picketed outside our centers. We sent like so many mass emails and so many dramatic reply all emails, like including the board of the organization, including our CEO. So we've been doing a lot of stuff like within the confines of the center in the pandemic for a while to kind of mess with them and get closer to what we want. It's interesting because even though there's been a lot of moments where management has been explicitly like union busting in their language and in their communications, one background is that we merged with like 29 other centers, Planned Parenthood centers across New York State to become PP Greater New York, like Planned Parenthood Greater New York, and that happened January before all this. So New York City is the only affiliate that has become out of this like larger affiliate that was unionized. We had already started that process and none of the other ones are. So our organization is kind of constantly, our management was constantly like kind of pitting the rest of the organization against us, or like just using this really, suggestive language to suggest that we're kind of like creating problems for everyone else. One specific example was that before our picket, they hired tons of extra security to protect the patients and the staff from the picket that was happening, as if we were on par with anti-abortion protesters that are outside. They like use this rhetoric to suggest that we were like putting our colleagues and other patients in danger and trying to interrupt services just for having an informational picket to like fight for our contract. And that's an example of just them pitting us against everyone else.
Dina gave us a little background into the issues they had already been dealing with pre-COVID.
A little bit before I started at Planned Parenthood, and I know that there was already a lot of change that had happened that people weren't super happy about. The whole merger thing, people were not really into. There was not a lot of support infrastructure built in. It was just kind of rushed decisions and rushed changes were made in order to create more revenue and just to be bigger and to expand more and for greed purposes. So many changes were happening. Like we were merging with these 29 other centers. We were getting a whole new medical record system all of a sudden, like just like changes left and right without any buy-in from the actual workers. It was all trickle down. All of a sudden, they expanded our hours until 9 p.m. out of nowhere. People normally working 9 to 5 or 8 to 4 or like 7 to 3 sometimes, all of a sudden, under the guise of expanding access, drastically changed our hours. People were having to work until 9 p.m., some places 10 p.m. because the patients, are there until 9, and then people are having to clean up services and get the center back or, chart or what have you. But people were not happy with that. And I think that was a big catalyst for getting people to unionize because they were just so distraught by her leadership and the decisions that were being made and the way that they were being forced to just change everything about their work life. And people were very upset on many different levels of the organization. So we started kind of challenging the board to take a look at what she was doing, giving tons of examples about how all these things were not actually beneficial to patients or staff. And we wrote several letters to the board. Nothing happened. We were all this time bargaining for our contract with the union. And then it's funny because the actual like build up from right before she left, I wasn't in the organization. So I'm not even sure on the ground what was going on in that way, but what I heard from my colleagues is that finally, all the press that we were getting from our fight and trying to spread the word as much as possible about how disgruntled we were and how upsetting and horrible a lot of the things she was saying and her behavior and her like outwardly racist attitudes. Finally, I think the pressure was on for the board and they realized they had to save face. And since Planned Parenthood is such a politicized organization and they need the public eye to look fondly on them and be able to help them survive, and that's the reality, is that like Planned Parenthood as an organization does amazing work and it's super important work, but oftentimes that is used as a tool against their own staff as a way for them to skirt responsibility for treating us badly or mismanaging their workers. So long story short, very dramatic, but finally the pressure was on from the public eye and they got rid of her.
I'm very sad that Planned Parenthood hasn't treated you guys as well as they should have, because
I know
they do amazing work.
They do. And I still stand by that. And I will stand by that for a long time. Like I can separate the impact I know it has on people from the political bullshit. So of course, I still believe in that too.
Despite everything that's been going on, Dina ended off with some truly local pride.
I grew up in New York City, and I forgot to mention this before. It has been so hard to see some of my favorite restaurants and small businesses close, and like seeing the city landscape change and seeing so many people leave New York. Like, on the one hand, it's actually been feeling so good staying here because everyone, like I said before, has like banded together. It feels like the OGs like stayed. Like, if you left New York, if you abandoned it, if you like left your West Village apartment and moved to Florida or whatever, you came and killed New York and then you left it, and we are thriving without you. And that's something that I really enjoyed, is just seeing people come together and help each other in this pandemic. So even though it's been so sad to see some places close, I know how much restaurants are suffering, and Luke knows I've worked in restaurants for the last 10 years before I was a social worker, so it's really hard, but I'm trying to see the positives that people have really come together. And for example, like this work that you guys are doing with the zine and with Vital Information, you see in these moments people's strengths and people's love for each other, and that keeps me going too.
Next up, Tamra Green. Tamra and I worked together in a restaurant, and this woman always had my back, sometimes in ways that I didn't even know about until afterwards.
My name is Tamra. Last name? Last name is Green, like the color. From Detroit, Michigan originally. I moved here in 2015, and I am currently a patient registrar in outpatient oncology at New York Presbyterian Hospital. In the very beginning, we were actually told not to put masks on. Wow. We were told not to put any surgical masks on. But if you felt the need to feel, to do it, and you're more comfortable, then by all means, you can wear a surgical mask.
How did they justify that?
Because they kept saying that it wasn't enough information or data to prove that masks are actually safe against the virus. Yes, and they kept using those words. We don't have enough data. We don't have enough information to actually say, yeah, all of our employees should be wearing masks when we're dealing with, this particular patient population, which are very highly immunocompromised as well. It was before spring. It was around March when the way things were getting very, very serious, but people weren't really sure. So we didn't see real, confidence in them, or we didn't really see any solid information coming from them. So I remember, and I will always remember that day when I remember we all put them on the same time because we were just getting so much information so fast on that particular day that we put them on at the same time. And then our manager came out and said, we're not mandating, this is not mandating, we're not asking everyone to wear masks. And we actually don't know if masks are actually full proof of you being protected. So you can calm down, so you can take them off. But if you feel like but at the same time, it felt more of them telling us and instructing us not to wear it. Mm-hmm. I was still wearing one until the DOH, gave it's okay to be maskless. Mm-hmm. If you're working in a healthcare facility until DOH declares that it's, mask can be off. Ah. So I was still wearing one because DOH had declared that it was okay for me, because it starts in January, and I usually remember wearing one from throughout February. Mm-hmm. For a couple of months. And then this happens.
They're like, take that mask off.
Yeah, it was just, we don't want you walking around wearing masks. So it was more like, y'all are worried about what we look like.
Right.
But we were seeing and we hearing information that masks are protecting you. Mm-hmm. Even the population that was going on over in China, they were telling us that masks are protecting you, protecting them is keeping the virus lower in certain areas with certain people if they are, in crowds and wearing a mask.
Did things kind of finalize or settle a little bit?
Not really. No, things just intensified. Of course, we know everywhere. But inside the hospital, even though in an outpatient setting, things became very hectic, very stressful very quickly because you're dealing with everyone else's own perceptions, everyone else's own comforts. of how everything is going around us. And that's also affecting our work dynamic with one another. If people and their families have gotten sick, still showing up to work, still not really understanding how our leadership or our corporate are going to approach us if certain things are happening with us. So when things began to intensify, a lot more people became more infected. Our patient population became infected. There was no real plan in place. And that is something that we saw immediately. We were like, they're not even prepared for if this really hits our department, our floor, our patient population, or one of us gets sick, because I feel like everything was scattered. They would say one thing and then do something else. They would tell us to do one thing and tell us, okay, that's no longer in place. These are the new rules now. I felt like that's when a lot of the stress began to really penetrate all of us. We felt very, isolated. We felt very just small, and it really did forget about like our emotional health and, how we're actually dealing with, certain amounts of trauma. Because mind you, this is also in the midst of the protests going on throughout the spring and the summer as well. Whether you were active in it or not, and I was. So you're still walking around with everything that's being expected of you for your job, and then you're also walking around with everything that's going on outside of your job. I said the patriarchy that's going on outside of this place is just as much as inside of this place. So I really started to be very adamant and very vocal about, checking in with everyone. How are we all really processing things on a day-to-day basis? Are you feeling heard? Are you feeling seen?
How did you try to do that?
I would just bring up those conversations in our meetings. I would say, let's take the time to really just check in with one another. We don't have to disclose any real personal things if you don't feel comfortable, but how's everyone doing? So we may not feel as comfortable or as outspoken with things because you may feel very, fearful something could happen with work, or you don't want to really say how you feel. But I said, now is not the time to be robotic. We have to really speak up because a lot of things are changing in the logistics of how this place is going. And I felt like through the summer, through the summer, and then going into like the fall, they kind of started listening a bit because they started to see, people who were losing, loved ones, who were nurses, who were, practitioners, who were on maintenance staff, who were one of us, our registrar, who helps, with the intake of patients, majority. We wear a lot of different hats all over the unit. It took that for them to take notice. And it also took that to see that a lot of us were barely making it through a whole week of work. If we didn't have this person calling out, or if we didn't have this person not there, or this person actually sick, or even one of our team members getting COVID, because I've had a couple of them who got infected. And a lot of that exposure was at work. It wasn't outside, because they would do their tracing and they would figure out that, this patient was infected with it. They were on the unit. Therefore, we were in contact with them. And going back to that, and we're saying, are you now paying attention? Yes, we could very well get it anywhere else outside of this place, but you guys are not taking this seriously and not really understanding that we're being continuously exposed because you guys refuse to decrease the volume, and then you're going to have to deal with these patients who feel entitled to do what they want because they've always been rewarded for bad behavior anyway. They show up and do what they want. They get the care and they leave. They show up and do what they want. It's just like a cycle. So they can tell us that, we traced this and this is how the person got it and this and the third. But, again, we're not dumb. We're paying very close attention. You have those who are much louder than others, and I'm pretty sure I'm one of them. But it's been very, very difficult to really even put forth a strong effort to want to believe in, the place that you work for and still think about the good things.
Tam addressed the problem with people demanding and receiving special treatment, a luxury she rarely saw granted for Black and especially lower income people.
we're still living in this bubble of entitlement when it comes to those exceptions being approved or being granted. Because we have people in situations that who, of course, want their loved one there, want that support, want them to be able to give them reassurance that things are going to be okay, have that comfort. But this is about safety, and that's it. And you need to get the adequate, help of transportation, or you need to get the adequate translation because you may speak a different language. I feel like since we're in the business of people and care and disease, it's definitely a compassionate way of looking at a lot of things when it comes to giving these exceptions to people. At first, since they did make that decision, like, oh yeah, a pregnant woman can't have their husband or their spouse or their wife or whomever there with them because it's just too risky. It's just too risky. We can't, because we allow this, we allow that. If we allow this, then we allow that. But again, like you said earlier, they forget that if you have your workers or your employees sick to a certain extent and it's spreading like wildfire, there is no care at that point. And that's something that I just felt like I was beating a dead horse with. But I said, I didn't care. I just kept bringing it up. I said, if you don't have us, then you have nothing. And I said at one point, the way that if you have symptoms there, like workforce health and safety, you have to give them a call, you have to say when they started, and it's like an automatic 10-day quarantine. They want you to stay home, if not for 7 days. But there's also an exception for healthcare workers. If you test negative, you can still report back to work. That's the exception. If you say you're starting to feel symptoms and then you take a test, you come up negative, it could be like the flu or whatever, they are still expecting you to come to work. I used to say, what's keeping us all from saying we all have symptoms and we're all calling workforce health and safety, and we're all at home? Nothing was really keeping that from happening. Then what were they done? You don't have a staff to help the patients, let alone, you have your nursing, you're gonna have this and that. But if all of us decided to do that, you wouldn't have anybody to literally run the unit on the administrative side. And I said, what would be keeping all of us from actually just saying, I have symptoms? Because we were some days, we're a team of 11 or 12, and some days and some weeks we will only have 6 people there. Half of our team will be out, and a lot of that was mental, emotional, and physical stress, and a lot of that led to people getting sick, even if it wasn't COVID. Literally just sick, literally just scared at the same time. We all knew that, from knowing our coworkers were like, okay, they're not here because this is how they're feeling. They're not functioning enough to show up.
Tam describes what she can do for Black patients.
Them seeing me is already reassurance because I look like you. So with so many patients who come in and see white physicians or white nurses and, our counterparts, it's already, a red flag. It's already like a defense put up. Am I going to get full, adequate care? Am I going to get fair care? Am I going to get the runaround? Am I going to have to wait, long periods of time? Am I going to be seen at all? Am I going to be told some lies that this is really what's going on with me, but this is, actually something that's really treatable, but I'm being given this. So first, I feel like that's really where we are at in changing and shifting all of these concerns and these fears with healthcare. We're needing to have this first contact of seeing people that look like us with our best interests at the forefront. So what I even tell right now to certain patients that are of color, that are Black, who, are battling for their lives with whatever disease that they're going through, I hope that I'm giving you some type of comfort, because I'm also in the step of your care. They're not just, there, just, be there. It's not just this empty, energy or this feeling. So I give as much, comfort and reassurance as possible. Of course, when you see your own, you gravitate towards your own, you want to help them in any way that you can, as much as possible, because you also see that they're only getting a certain amount from the individuals who are really supposed to be transforming what's going on with them. I would tell them just to continue to be strong and know that we are here, know that we're going to continue to show up for you. You can only be, empathetic in so many different ways, but you also have to put, yourself behind that person that you're trying to help. Because it always seems like, and even today, that it's to the convenience of the physician. It's always to the convenience of whatever their schedules are, whatever type of treatments that they want to administer, and this and that when it comes to telehealth and other appointments and things of that nature. But really try to identify as much as possible with where this patient is coming from, how many challenges it takes for them to even come and see you. Why aren't they keeping their appointments as much? Because they're having issues with this. And I know doctors can only go a certain length with helping, and that's when you have other resources that come along with the social workers and other things of that. But that's where patient care starts.
I asked Tam to tell us how she's been doing through all of this.
I'm here. I'm surviving. I really, really felt that trying to process this and not be too hard on myself was going to be such a major task, and not to go about, this and just try to function on the surface. I would say, I don't know, I have a real passion just for helping people. It may not be in healthcare at this point right now, but I know it's my job and I know it's a responsibility that I take very seriously. But it really just started to show me things that I wasn't really paying attention to. I felt like I was going through a lot of just things, just very robotic. Things became very discouraging. I felt like I had a new level of stress. I'm like, oh, okay, I've been in stressful situations or I've been through things, but I'm like, this is different. Wow. And I took a lot of that within my health, and I was diagnosed with lupus in 2018. So I'm just like, okay, I have to go about a lot of things differently and still keep those things in mind. But I don't know. As it started, I've realized that I'm much stronger than I thought I was. It's shown me a lot of my resilience for other people as well. From seeing so many others very weak or at their lowest or their worst, it showed me that it's just this is where I'm supposed to be doing. This is where I'm most helpful, and this is where I'm comfortable. This is where I'm feeling most fulfilled as well. In the midst of all this craziness, it makes me feel very good that I can show up for other people. And a lot of that was with my coworkers. I used to see some of them feel very defeated and deflated, and I used to be like, look, we have to just stick together, claim this unity, and keep pushing forward and keep supporting one another.
Thank you, Tamra. Now, Kaslyn Bos.
I'm Kaslyn. I've worked in the New York City bar and restaurant industry for 3 years now. Before that, I was in Florida working in the same industry. So I think overall I've been a bartender or a server for 7+ years. Currently, I'm working at a cocktail bar in Manhattan, Midtown area, at the top of one of the hotels near Times Square. Yeah, so for pandemic purposes, we all lost our jobs with the shutdown last March, mid-March. And then for 3 months, essentially, I was out of work, like most people in our industry. Yeah, and I was asked to go back to a job that I no longer work at in Williamsburg because they were doing this pop-up outdoor bar setup, just doing to-go drinks, to-go food. It was a cool setup. I started working there maybe 2 days a week back in June, which from my experience talking with other people in the industry was a lot earlier than some. Some people worked throughout the whole summer doing just takeout for their businesses. I didn't have that option, so I stayed home. So June, went back to work, pop-up bar outside, worked through that, worked through the first stages of having outdoor dining throughout the whole summer, worked through, being able to build out into the streets of New York, which was new, worked through the first stages of indoor dining, worked through indoor dining getting shut down and being unemployed a second time. And now we're faced with going back to indoor dining. I think it's difficult to sum up and go into, or even like to go into every detail of what the past, 9 months has been in this industry, but it's been difficult. I do want to preface that by saying that I think I'm somebody in the bar and restaurant industry who's been very fortunate throughout this whole pandemic. I was able to quickly get onto unemployment where a lot of people had trouble. I was somebody who got full unemployment, which was, very, very fortunate. I'm somebody who got to go back to their job, period, let alone for as long as I got to go back to my job, and not only one job, but 2 jobs.
What were the reasons that you had to go back?
I felt pressured, not forced. And whether this was, let me rephrase this. I don't believe that was the intention of the people I work for, especially the restaurant in Williamsburg. I had worked there for 3 years by the time I quit. I don't think their intention was to pressure me, but the result was pressure to go back. And at first it was like, you can come back for like 1 or 2 days, right? And I was like, okay, I think that's all I can handle. And then with outdoor dining looming, maybe that's the wrong phrase, but looming, they needed staff to run it. A lot of people didn't want to come back for obvious reasons. Either they weren't comfortable because we were still in the throes of a pandemic in, late June, July, still kind of rampaging through New York. So either they were uncomfortable or they were on unemployment and were still getting the $600 extra and were making enough money that it didn't seem worth it to go back for money that wasn't guaranteed in an industry that's notoriously unstable when it comes to income. But I was one of the more senior members of staff. So I did feel pressure, again, whether that was from them or from myself and my expectations of myself as an employee. I don't know. That's a question for my therapist, I think. Yeah, I just felt a responsibility and an obligation to go back. And, when I did go back, I do think that little by little, they pressured me into doing things that I didn't sign up for. And again, I don't believe that was with malicious intent. I think that's simply how it went. Yeah, but I went from 2 days a week just working an outdoor bar to, 5 days a week working crazy hours with very little staff. It was pretty exhausting, especially at the beginning. Luke can attest to that. You don't work for 3 months and all of a sudden outdoor dining opens up, and good news, you're making money. Thankfully, people come. Bad news, you're working with maybe 50% of the staff you had before. So for instance, the first week we had outdoor dining was crazy busy. And we had just myself, a bartender, and a manager on the floor, 3 people, handling about 100 covers. That's a lot. For those who don't work in the industry, that is a lot of people coming through your space and you having to take care of them, and not a lot of support in the job, which would be difficult, but I think manageable on my end, at least as an employee, as somebody who works. You can hustle through that. We're not afraid of the work at all. I think one of the biggest disappointments early on, and something that has continued, has been the expectations of guests on what their experience should be. At the bar that I work at, we did lose a coworker to COVID during the summer. Like, somebody that we worked with pre-pandemic, during the shutdown, died. So when I went back to work, I took it very seriously. It's like I've already had a coworker die from this virus. I would really like to not have that happen again. So in terms of safety, I'd say the bar, when it reopened, opened for indoor dining, and I think was better prepared for safety guidelines and having those in place, and understanding that they needed to have 6 feet apart, understanding that everything needed to be sanitized, providing masks, wearing gloves, like had those procedures in place, but they had until September. With the restaurant that I worked at, every week was different. You were constantly winging it because the information was changing so quickly. So when outdoor dining became a thing, we had a very small staff, and I am a very vocal person, and I did mention at least twice a week things I thought we should be doing to make sure that our guidelines and our boundaries were respected by the people who are coming as guests to the space. I thought it was really important that expectations for guest behavior were clear to anybody who walked up. That didn't really happen. It took a long time to happen. For instance, we had a chalkboard outside, and at the time it just said our hours, and I suggested to management that we should write our guidelines down on the chalkboard so that anybody who comes up has absolutely no reason not to follow them. We should write, like, when you're not seated, please have your mask on. We should write something like, if possible, when not eating or drinking, actively eating or drinking, you should have your mask on. Or when you're talking to staff, please have your mask on. We should write, that we have hand sanitizer available, that you can wash your hands inside with your mask on. That didn't happen very quickly. That probably took at least a few weeks to get a chalkboard going up. I also suggested to them that they should use their Instagram platform to post guidelines, to say, and with respect too, to guests, not trying to be condescending in any way, but just to say, for the safety of our neighbors, our community, and our staff, please respect these rules. No matter what your expectations are as a restaurant, no matter what guidelines you have in place, at the end of the day, you are beholden to the expectations of the people who walk through the door. We are expected as an industry to cater to their every whim, and through the pandemic, that structure, pardon my language, showed its ass. And like any societal structure we have at large has had a microscope on it, or a magnifying glass on it, through this whole period of time. Within the restaurant industry, the fact that guests would blatantly ignore what you were saying, ignore the rules that you had in place for your staff safety because they didn't feel like it, or like, why do I have to wear a mask? Because we're telling you to. Whatever you believe, whatever you think is safe for you is fine, in your own space, would be my message to a customer. That's fine in your own space, but you're coming into a business and they have rules in place. And to me, I think of it as like a social contract. You will follow those rules when you enter this business. So that idea that the customer is always right is one of these absurd pillars of the restaurant industry. The customer is not always right, and we know this, but we're supposed to behave in a way that makes them feel right at all times. Under extreme circumstances, are you allowed to tell the customer that they're wrong? And it just simply did not and does not work during a pandemic. And customers believing that they not only are they right, but they have the right to treat staff however they want. Why? Because they have the money. And if we want to go into that, this is such a large conversation, but in my personal opinion, because this is a tipped industry and because it is a service, the people who come into the space feel like they have ownership of the space. Why? Because they're paying my bills. So that gives them a power I don't think they have, for instance, in somewhere like a retail shop. Definitely not a doctor's office. A restaurant or a bar is a space in which the customer has power over you. And I think a lot of that has to do with the fact that they are paying your salary or your hourly because they are. Yeah. So with that in mind, so a customer walks in, they feel like they have power. They feel like they have the right to do as they will, the right to talk to you as they want. And the expectation is that you will stand there smiling under your mask or nowadays the 2 masks that you're wearing to work, and take it. You're just expected to take it. And I've been in this industry for a very long time, as I said. I've worked in restaurants in areas of the country where you're subjected to, sexual harassment or unsafe or gross working conditions, or you have to work for 14 hours and you have no break, or things like that. So I've seen a lot of the bad side of this industry. I've seen a lot of the good. The attitude that I was getting from guests, especially when we first opened outdoor dining, is probably some of the worst I've been subjected to in my time in this industry. And with that, I think I want to go back to expectation. Like the expectation when we reopened, I think for guests who I will give the benefit of the doubt, maybe they didn't know better. That's me being generous. You should know better. But I'll give it to you. Maybe you just didn't know that we had no staff, that it's 90 degrees outside, that I have no control over the sun or the elements at all. And yes, it is hot. No, I can't do anything about it. I have no control over the fact that I'm one person trying to handle, maybe 15 tables at a time. I have no control over that. And I'm doing my best. But the reaction to that and the understanding from that was alarmingly lacking from the guests. When people have asked me about my experience, especially over the summer, I would tell them that it's probably 70% bad or with guest experiences and like 30% good, positive. If we want to talk about like specific instances, I had one of those nights. I had one of those nights. 15 tables. It's hot outside. I'm wearing 2 masks. We have no staff. We're very busy, and obviously it's a stressful situation under normal circumstances. So add to the fact that we're still in the middle of a pandemic, and I am going up to all of these tables and all of these people, and they're not wearing masks around me. Naturally, I'm stressed. I had, on a night like that, I had a table come up to me after they finished their meal and say these words exactly. Have a good night. Just one thing before we go. You need to relax. You're clearly stressed. And the only thing I could do was stand there, gobsmacked, and say, okay. I mean, in a perfect world, I would go back to work and all the guests would follow the rules and just be lovely, but we very much don't live in that world. And like I said, this is a very timely interview because Valentine's Day is coming up. Indoor dining is expected to open again, and I technically can still work for a company that will be opening, has to open on Valentine's Day. And I think that's true for any bar or restaurant in New York City that wants to make it. Like, you have to open on Valentine's Day. If you don't, you're going to miss out on a lot of money as a business. Where it comes to staff, that means that staff are now going to be, across our city, are now going to be presented with the exact same question that I have to answer myself. And that's, do I want to go back? What are the repercussions if I don't go back? Is it safe to go back? And I don't have a lot of answers to that right now. I can only speak for myself. Do I want to go back? No. Not particularly. What are the repercussions of that? Could be that because of the demand for indoor dining, especially on Valentine's Day, and because you do need staff to make it happen. If enough staff say they don't want to, it's not that they're going to be fired for that, but other people will need to be hired. So it's not that you're being flat out fired, it's that the possibility of you rejoining that company goes down for every new person they have to hire because you're not comfortable, which we've seen happen across the city already. Is it safe to go back? Let's see. Last night, I wore not only one KN95 mask, I also wore another surgical mask on top of that. So as staff, we will most likely, because of these new strains and because of suggestions made by the CDC and other health organizations, we will now be wearing 2 masks as a staff at, hopefully, if you're trying to be safe, amidst a sea of people who are wearing no masks. So I don't think it's safe. And I personally don't know what to do about that. Do I think I can handle 2 days a week? Probably. Will I hate being there for those 2 days a week? Probably. I don't know. I might need a prescription for Xanax before I go back to this job. You know, the way I think a lot of people have been coping is to drink through your shift to manage the stress and anxiety. And none of that's healthy. We are, as an industry, being fucked hard by this pandemic with no real relief in sight and no real options. We can't even get a vaccine. And here we are just waiting to go back and bow down to our guests and just take the abuse or take the snide remarks or take the eye rolling or allow the person who only has a holy ass scarf as a mask to just walk all over us. And we're supposed to be grateful that we have the opportunity to go back and take it. Who helps us, right? We help us. So I have resources available to me. I've made decisions for myself to try to heal and to try to gain the skill set that I need to handle this, whether that's compartmentalizing or just stress and anxiety management. And I'm doing those things for myself. Not everybody has that again. So I think, you know, you as a zine do a lovely job of putting out resources, you know, whether it's mental health resources, which so many people need access to affordable mental health care right now, whether it's that, whether it's, you know, relief funds for people in this industry who've been displaced and are at risk of maybe like losing their housing or they can't feed themselves. You know, there are a lot of programs that have been working to help that. Whether, I guess, it's trying to lobby for some sort of relief package for this industry to save what remains of our local businesses after so many have already shut down. There are things we can do as a community, and they seem big and looming in some ways, but if we want to end on a note of like hope and something positive about this whole experience, is that I can say without a doubt that the restaurant, hotel, you know, the hospitality industry is resilient in a way that I think we've always known, but have seen tested to its absolute limit recently. It's resilient, it's creative, and it's close knit. If you're in the restaurant industry in a place like New York, you have so many friends who are in it with you, or you know so many people at, you know, your favorite bar or restaurant. And we really do, as a restaurant community, a bar community in New York City, take care of each other. And we've seen that in so many different ways, from restaurants offering free meals to hospitality workers, to restaurants raising money for their staff, you know, what money they could. That simple understanding, a conversation with a friend from a different bar in which you can just like vent it out. You know, it's made me feel closer to this community. And it's just an industry full of such wonderful fucking people. And it's been so painful for everybody. But we've been able to be there for each other. And that's something, at least, you know, the camaraderie that comes out of this, the creativity that comes out of this. But hopefully somebody helps us out. You know, if this were the end of our conversation and your question to me was, what is the thing that you most want people to know about the restaurant industry right now, it would be, you need to wear your mask when anybody who's not part of your party is at your table. Put that thing on. Put that sucker on. It's not that hard. Sit outside. It's cold. We know this. Every adult, at least in New York City, checks the weather before they leave their house to know what they should be wearing. So wouldn't you think the same about the restaurant you're about to dine at? If you think you're going to be cold, do not expect that I'm going to have extra heaters. Do not expect that I'm going to have blankets for you. Pack a blanket, wear layers, bring extra scarves, extra jackets. If you want a tote bag, I don't know, there's probably a local restaurant in your area that is selling them. Become prepared. Yeah, and then 3, you know what? Maybe have a little bit of empathy, a little bit of understanding and patience, because as we just expressed over the last hour of conversation, this is an extremely stressful situation for the staff that is serving you. Do they want to be there? Maybe. Do they have to be there? Probably. Do you have to be there? Nope. So if you're dining out, don't be a dick. You know, isn't that the golden rule? Don't be a dick. We are trying our hardest. Help us out, please. don't be rude, keep your mask on. I don't know what else to say. That's it. Those are 3 things. 3 things. 3 rules. I think that they're pretty easy to follow. I guess my 4th would be tip appropriately, meaning tip 20% or higher.
I think the takeaway from this is that we can keep each other safe. But we need to remember that our convenience is not the only thing that matters. I wish those working in restaurants during Valentine's Day luck. And if you're patronizing working human beings, respect what they ask of you when you're on their turf. Luke Matarino's zine, How to Eat in a Restaurant During a Pandemic, is for sale at $10. If you're in the service industry, you can get it at a discounted price. Wear a mask, be respectful, and thank you for doing this. My name is Yael Megan, and this is the Vital Information Podcast.
Hey all, this is Luke Manarino. Thank you for listening to the Vital Information Podcast. We are a collective that hopes to bring vital and helpful information to those tuning in. You can access our printed material and zines on Instagram at vital3_information or by emailing us at vitalinformationzine@gmail.com. The Vital Information Podcast is available on iTunes, Spotify, and Google Podcast. Please like, subscribe, follow, rate, and review. Thank you.